Hi, I'm Dr. Kurt Wohler. The title of this Autism Biomed Essentials video is Benefits of Nutritional Lithium. So this video is sponsored by autismrecoverysystem.com. This is a website, a membership website for parents and caregivers with children or teenagers or adults, loved ones on the autism spectrum or other special needs. For more information, you can go to autismrecoverysystem.com or email us with questions at autismrecoverysystem@gmail.com. Within the Autism Recovery System website is a number of sections for different resources. There's videos, articles, other information. There's a forum where you can post questions. And there's also a comprehensive 6-module biomedical course called Autism Biomed Essentials. Here's the disclaimer for this video, understanding that the information provided is for educational purposes only. So one of the things that has been recognized now for many years is that many individuals on the autism spectrum often have low levels of nutritional lithium. This is not lithium levels that would be indicative of a medication, but nutritional levels of lithium. And there's been a lot of studies that have actually looked at lithium levels, particularly in hair test, either directly in individuals themselves or mothers with autistic children also tending to have low lithium levels. Now, one of the things that I often do and advocate for is a hair analysis, also sometimes called a hair elemental analysis, to evaluate certain minerals, not all, but certain minerals. And one of those is to get a snapshot of lithium. Now, there's no test that's absolutely perfect in everything that it assesses. And so hair testing certainly has a lot of upside, particularly with regards to metal exposure and certain minerals. And then sometimes you have to do mineral testing through blood as well. But the lithium levels on the hair often seem to at least correlate with some dramatic behavioral changes that we see in many autistic individuals. Now, we know that lithium and brain health is interlinked. So lithium actually stimulates brain stem cells. It can also help the brain recover from injuries. So this could be something useful in certain individuals that might have brain damage from concussions or some other type of brain trauma. And then in autism, what's interesting is that lithium also helps to somewhat buffer against what's called glutamate hyperexcitability or excitotoxicity. Glutamate actually triggers excitatory activity within the brain, and too much of that activity can cause oxidative stress. So this was a case that goes back many years, and this was actually uh, some correspondence that I was actually having with a father regarding his son, who was, as he described, disrespectful, argumentative, withdrawn, distant, sullen, and depressed. And one of the things that we put, in fact, it was the main thing we recommended for this individual, was to try a little bit of lithium orotate, around 4.8 milligrams to start daily, which is not a lot. And in a very short period of time, this particular teenager went from being described as argumentative, disrespectful, withdrawn, distant, sullen, and depressed, hated being in school, wasn't doing well, to having almost a complete 180-degree turn towards the positive. His attitude was improved. He was talking, he was telling jokes, he was laughing, he was doing well in school. And this transpired over about a 60 to 90 day plus, maybe a few more months after that transformation, but very, very dramatic turnaround, with this being really the only supplement that had been introduced. Now, I'm not claiming that lithium is some magic bullet or single remedy for autism, but one of the things to understand is that many individuals who have lithium deficiencies are often more inclined to behavioral problems, dark mood, depressed, argumentative, sometimes very combative. And so it can be a useful thing to at least look to implement if this is something that is happening with your particular loved one. You certainly should, in all of these cases, be talking and corresponding with your personal health provider. So what I do is I do hair testing within my practice, and then if it's low, we'll often recommend various nutritional supplementation. And so these come from a particular company called New Beginnings Nutritionals. And we can see here the lithium chloride, 500 micrograms per 10 drops, pretty standard. With most smaller kids, I will usually start between 3 to 5 drops. And then there's different sizes or amounts with regards to the lithium orotate capsules, 4.8 milligrams or 10 milligrams. It's one of these things that's not exactly dosed based on age or weight. It's really kind of based on need. But these levels are nowhere near what you would get through, let's say, pharmaceutical or medication lithium. And of course, if somebody is on lithium supplementation, this would not be appropriate. So there's obviously a lot to learn about these particular nutritional supplements, lithium being one of them. So this video is not complete in all of the different aspects that can go into understanding the use of nutritional lithium, but in general, it has been a very positive remedy for many kids in my particular practice. If you have additional questions that you would like to post to me regarding nutritional lithium, my use of it, or other aspects of biomedical intervention, you can always join us through the autismrecoverysystem.com website. And there's a forum within there where you can post questions. And then also, again, within the website is that comprehensive 6-module course called Autism Biomed Essentials. So all of that information can be accessed at autismrecoverysystem.com. And please email us at autismrecoverysystem@gmail.com if you have questions. Again, I'm Dr. Kurt Wohler. Thank you.